Okay, let's go ahead and open up the doors. Hello, everybody, and welcome to Daily with Doc. My name is Becca Dukes, and as the hostess of this program, I am super excited to be able to use my stories, my experience to help people around the world. And doing that has given such purpose that I am so grateful for, because so many people are benefiting from the information that is shared on this program. I get emails and text messages all the time sharing their gratitude for the message that we are presenting to you today. And folks, today's topic is something that's kind of near and dear to my heart, because I was told a lie for so many years that I was just bound and determined to get all of these different conditions that my mother had, my aunts had, my grandmother had, my great grandmother had, even going into the uncles, the grandfathers, all that, because of genetics. Well, I am very happy to say that the science of epigenetics has been spoken of since the 40s, 50s, but really since the 1990s. And in this science of epigenetics, it gives us hope in the fact that, folks, genetics has to do with DNA. But there are things around us that affect our health that we do have control of. And that is what we're going to be talking about today on Daily with Doc. Now, this program is being sponsored by DailywithDoc.com, where we have a lot of the information that you're going to be hearing about on our website, including the good foods, bad foods list, and a store that has the products that will be spoken of. And folks, if you were recommended by somebody specific, make sure that you get back with them. Thank them for taking the time to share this program with you. And also say, hey, how can I get involved? Or what can I take to help me have a better health journey? So, I'm so excited because we have so much going on with all the different platforms that we are streaming on. If you are watching us on one of the platforms, whether you're live streaming with us or watching a replay, make sure that you subscribe to our channel and also send us a comment. Let us know where you are watching from, because we are reaching people around the world. And I love the fact that there are no boundaries when it comes to the internet and where this message is being heard, because it is not specific to any demographic, not specific to any skin color. Folks, we are equals. We were created by the same creator. And the fact that we were just proves that when we give the body what it needs, the body can do some amazing things. So without further ado, let's talk more about epigenetics. Epigenetics is a science that has proven the genetic theory of disease transmission is incorrect. Incorrect, folks. So if you were told that you have a genetic disease, find some hope in today's message, especially in the fact that we have one of the founding fathers of the real definition of epigenetics with us here on the Daily with Doc. He is an amazing doctor that didn't start as a human doctor. He started out in the labs, working his way through college, going into being a veterinarian, which, folks, I know a lot of people that take a lot of good care of their dogs and cats and birds and fish and snakes and lizards. And if anything's going wrong, because we're paying attention, you take them to the vet, right? Well, the pets can't tell the vet what's going on, so the doctor has to really pay attention and know what to look for, because you can't verbalize Well, and that's where Dr. Joel Wallach has really excelled, to the point of going through the pathology lab, looking at different slides, looking at what was causing demise in animals, and be called upon to help save the white rhino, which was a very successful expedition. So today we're talking about epigenetics. This way, there we go. And I would like to bring on the camera with me, as he has such a great big smile on right now, Dr. Joel Wallach. Folks, welcome to Daily with Doc, and this is the doc that is the inspiration of Daily with Doc, Dr. Joel Wallach, with a BS in agriculture and science, a doctor of veterinary medicine, three postdoctorates in pathology. And if that wasn't enough, after teaching nutrition at the college level, became a naturopathic physician. Dr. Wallach, welcome to Daily with Doc.
Well, thank you so much, Rebecca, and thank you for all you and your team does. Right now, especially all the crazy things going on, the earth needs a lot of help. The humanity needs a lot of help. The animal world needs a lot of help. And we have the information. In most cases, we have access to what is needed to solve the problems. It's just a matter of teaching the Army. And so I can't thank you enough for making sure that this is getting done.
Well, absolutely, Dr. Wallach. You know, I heard your message, as many of my team have, on the radio. And whether it was part of the Daily with Doc, or sorry, Dead Doctors Don't Lie program, or you on
Oh,
okay, I need somebody to not mute me, please. Thanks so much, team. But as I was saying, you know, you've got the Dead Doctors Don't Lie, which was a radio program for many, many years. Yes, you're holding up the book. Thank you so much. And also many years with Art Bell on late night radio, and now with George Norrie, which you're going to be on again tonight with George. So you've got a long day ahead of you for sure. This message has been touching people around the world, Dr. Wallach, around the clock. And it is my honor and privilege to be able to bring you to even more platforms where people are to hear this message. So with the science of epigenetics, Dr. Wallach, what was some of the first, I guess, events or projects that you worked on that led you into things not being genetic when it came to the death of any species?
okay. Well, let's go back to where I was working at the St. Louis Zoo, working at the Washington University in St. Louis while I was going to veterinary school. And I was able to help families with their kids' problems because I was using the nutrition we use in animals to solve their problems. And when a kid had the same problem, we give them the same food we're giving the animals, we got rid of the problems. And so it was very, very obvious that the medical doctors were missing it badly, and they were treating the symptoms, and people were happy to get the symptoms relief. But we got rid of the disease by giving the human what they needed. And that's where this came in, you know, the epigenetics story. There you go. And it's just really, really a great collection of information. Everybody should have this book. And it's one of those things where the project that really happened was at that point, Marlon Perkins, the old Mutual Wild Kingdom show on TV, director of the zoo at St. Louis, and I worked for him for many, many years. When I graduated high school, he sent me to Africa to work on the White Rhino Conservation Project. He knew that he could depend on me, okay? And so, because I had worked for him many years in the zoo, and so I'm doing all these autopsies on animals of all kinds in Africa, running wild. And we're talking about the primates and um, four-legged critters of all kinds, um, doing autopsies on them and finding parasites and disease and so forth and writing it up. And when I came back after 2 years in Africa, Perkins gave me this list. He said, here's a list before I put you to work here at the zoo on this big project we have in autopsies. I want you to look at this list and find out what's going on here. Well, the first thing on the list was that every species of bears in the zoos around the world were getting liver cancer. He says, why are they getting liver cancer? It must be a genetic thing. Well, if every species of bears are getting liver cancer and they're all over the world in the different zoos, there must have been something else going on. And sure enough, all the zoos around the world were selling peanuts to the guests so they could throw them to the bears. And peanuts grow in the ground and they get contaminated with a mold called aspergillus, which makes a toxin called aflatoxin, which causes liver cancer. And so it took me about 2 minutes to figure that one out. And so we got together a program where we switched them over to monkey pellets and dog food and so forth to throw to the bears and sell to the people so they could run the zoo financially. And within a couple of weeks, the new cases of liver cancer in bears around the world just stopped. You don't hear about that anymore. Okay. And it was just really great. And we got a big grant. Perkins got a grant of like 12 million bucks. Okay. And he made me the top pathologist on the project. To make a long story short, 10 years, I did over 25,000 autopsies on one project. Okay. And the book that came out of it, there was a lot of books that came out of it, including that book, Epigenetics, Hell's Kitchen, those books. But the book that really, really made me very, very happy was the book that showed that the world was connected closer than we thought. Okay. And what was going on here? And there was a disease called cystic fibrosis. It was supposed to be one of these genetic diseases, birth defect. And I did the autopsy, no. Did my research, no. And so basically, to make a long story short, I got the one that I cured. This kid is, under 3 years of age. Got him cured of cystic fibrosis. And I didn't tell the people that this was a human. I said, what do you think here? And said, oh, it's cystic fibrosis. Good. And so then 6 months later, okay, after my treatment with all the nutrition, sent it to the same people again and said, what do you think about this one? Oh, nothing, no problems here. This is all normal. Okay. And they got excited when I said that this was a human that we had reversed the disease in, but it still, quote, had the DNA, right? So they wanted to do some more research and so forth. And it was just really amazing. And so, in the book that came out of that I really, really like, is called Disease of Exotic Animals. That book covered all the cases, all the pathology cases, and all the clinical cases we did for the 10 years at the St. Louis Zoo and most of the other zoos around the United States and some from around the world. They're all in that book, Disease of Exotic Animals. It sold for $25,000 each. Okay. It was published by one of the biggest publishing houses in the world of textbooks. It sold for $25,000. And they sold about, 10,000 of them. And then after a while, everybody who could afford them, who wanted them, had them. So they reduced the price. You could go online now and ask to see, are there any other copies of the book, Disease of Exotic Animals, for sale? And they'll say, yeah, $3,000, $1,500, that kind of thing. Because, the dog chewed on it and got rained on and that kind of stuff. And they may be 20 years old. Okay. And so just about anybody who has an office or a clinic or a university can afford $500 or $100,000 for a textbook like this. it'll blow your mind, the information, all the pathology, okay, out of, I'd say closer to 25,000 autopsies in that book, Disease of Exotic Animals. Very, very proud of that. And that got me into a position where I could lecture at universities and lecture at organizations and physicians and veterinarians and so forth, and around the world, not only, not only locally, but around the world. So I was doing a lot of traveling, giving lectures because of the book Disease of Exotic Animals. And so that led to more grants and so forth. And the trail that we have left, which was an expansion of the book Epigenetics and the Wallach Revolution, okay, the Wallach Revolution. And then, of course, Hell's Kitchen talks about the 3,000 years of using wood and coal as fuel. And we put the wood ashes in our gardens for fertilizer. We put the wood ashes in our food for spices. And then in 1888, thank you, 1888, the big thing came along here because electricity came, and we replaced wood and coal as fuel with electricity. And suddenly now, by 1900, we have all these hundreds of diseases that nobody had ever seen before, because people were not getting their minerals anymore because they didn't have access to wood ashes and coal ashes anymore. They were using electricity. And this is what I discovered and put it into the book Hell's Kitchen. It blew everybody's mind. Okay. And let's see here. Right now, medical doctors are very happy. Right now, medical doctors are very happy. Let's see here. Each year in America, medical doctors earn in their clinics $345 billion a year just treating symptoms of Alzheimer's disease, not preventing or curing it. Each year in America, medical doctors treating arthritis get $626.8 billion, double that of Alzheimer's disease. Okay, not to prevent or cure it, but just to treat the symptoms. Diabetes, $342 billion. My favorite one, though, is osteoporosis. Osteoporosis, the United States, Canada, and the EU combined each year earn 6.5 trillion with a T, 6.5 trillion just to treat the symptoms of osteoporosis, not to prevent or cure it. So you add 6.5 trillion to 626.8 billion, and you have $7 trillion being used to treat osteoporosis symptoms, not to prevent or cure it. And so
Part of that
I'm sorry?
I contributed financially to that number
Well, there you
myself,
go.
but they
And
didn't tell me that's what it was, Doc.
they didn't know. Okay. Then, I don't know, about a year ago, I was getting so many people come to me 3 years ago. Yeah, thank you. So many years ago, I was getting people coming to me and saying, my doctor says, I have to have this surgery, that surgery. I said, why? Well, I have this, and this. No. I said, let's do a scan of your head. And sure enough, what I found was I had osteoporosis of the skull.
I've got it for you.
Oh, thank you. I had osteoporosis of the skull. There you go. Top one's a normal skull. Top of the skull has been taken off. You're looking down on the brain, and you see the skull is a quarter of an inch thick, normal bone. The bottom one, the top of the skull has been removed. You're looking down on the brain, but the skull is 1.5 inches to 2 inches thick because the connective tissue that has replaced the skull bone is not bone. It's connective tissue, okay? And it squeezes 12 pairs of cranial nerves, and there's a chapter for each one of the cranial nerves in this book. It's on your head, and it goes into, there you go. There's a chapter for each of those nerves. And then, of course, we have a CD that goes along with that, same title, that covers the spinal cord. And just quickly, when you lose your sense of smell, that's the cranial nerve number 1 being squeezed. You have optic nerve atrophy, and you slowly lose your vision. Okay, that's the second cranial nerve, the optic nerve being squeezed by your skull, and you have osteoporosis of the skull. Ptosis, the pupil doesn't respond to light. That's cranial nerve number 3. Cranial nerve number 4, double vision. Okay, cranial nerve number 5, trigeminal neuralgia. Boy, talk about pain in the face. Whoa. And then cranial nerve number 6, double vision, strabismus. Cranial nerve number 7, Bell's palsy or face droops. Cranial nerve number 8, tinnitus, ringing in the ears, deafness, vertigo, Meniere's disease. Cranial nerve number 9, loss of the gag reflex and the sense of taste. Cranial nerve number 10 being squeezed, get gastroparesis, COPD, hiccups, and all that kind of stuff. Cranial nerve number 11 gets squeezed, you get loss of the ability for your arms to go up. Okay, squeezing the trapezius muscle nerves, cranial nerve number 11. Cranial nerve number 12, you have atrophy of the tongue. Also, you have Erb's palsy, you can't hear very well. And so if you have problems with cranial nerve number 9, number 8, and number 12, you're really in trouble with communications. And here's the scary part, and this is where we're going to talk about more serious stuff, if there is such a thing as more serious stuff. When you look at the top diseases, okay, that have to do with the nerves, okay, and all the other stuff, diet and nutrition. Let's just look quickly at the cranial nerve number 1. Okay, let's back up here. The country, number 1, they have the longest lifespan, Hong Kong. The country, the community, number 2 is Macau, 85.51. Hong Kong is 85.53. Japan is number 3, 84.95. Switzerland is 84.9. Oh, wait a minute. They're not Asian. No, but they do get glacial milk, where the glaciers are grinding up the mountains, and the water that they're drinking, cooking with, and putting fertilizer in their gardens have all these minerals. Number 5, Singapore. Their average lifespan is 84.20, about the same as Switzerland. Okay, and I could go on, but there's 100, and this data all comes from the United Nations. That's not mine. That's the United Nations. So where's the United States? The United States comes in number 47. There's 46 other countries whose peoples live longer than us. There's 46 other countries whose peoples live longer than us. Our life expectancy is 79.74. This all comes from the United Nations. Now, it's one of those things where you have to appreciate that you're in control here. Once you know what to do, how to do it, what to stop, that's why we have the good food, bad food list. And we have these programs that are designed to prevent, reverse over 600 different diseases. Okay, and we've been doing this for 75 years. Now, I'm 84 years old. Most people can't believe that. Okay, these are all my teeth. Okay, 84 years old. And so it's because I've been doing this since I was 9. And so you have to read the story, okay? And it's one of those things where there's a lot of stuff that we can do. And just think about it. We rank 47th in the world when it comes to longevity. And our doctors stand on top of the mountains and beat their chests and say, we have the greatest medical system in the world. Well, in some cases, for surgery, you get run over by a car and you're bleeding internally, you want to go to a surgeon. But when it comes to health and longevity and eliminating birth defects and stuff like that, you want to go to the book Epigenetics. You want to go to the book Dead Doctors Don't Lie. You want to go to the book Hell's Kitchen. You want to go to the Wallach Revolution. You want to go to our flip chart. Okay? And you'll get the information you need to have a very healthy, long-lived family and community. And this is unimpeachable. Again, we've been doing this for 75 years, and we're very, very proud of this. And so I'll throw this back to you right now, Becca.
Well, Dr. Wallach, tell me, how does this relate to epigenetics?
Well, epigenetics says that you have control. In other words, there should not be any more birth defects, because there are no birth defects that are caused by a bad gene. Okay, birth defects are caused by nutritional deficiency of the embryo during a certain developmental moment. Okay, And if the mother's been taking the 90 essential nutrients in optimal amounts and avoiding the bad foods so she can absorb everything, get a hair analysis, see where all the numbers are, make sure everything's right, then you start having babies. There'll never be another birth defect. Okay, because
Okay.
birth defects are caused by nutritional deficiency of the developing embryo.
So how about, I know with some of the neurological diseases, MS, so even the cognitive diseases that have to do with dementia and Alzheimer's that have been said to be genetic.
Okay,
Is that true?
no. Let's look at that. This is one of the great stories in the flip chart we have. Okay, Dr. Wallach's, there you go. Dr. Wallach's, was it
That's the 95 or the 90 for life
Life Crusade
to
to
save
save
humanity.
humanity and the world? Okay, there are 75 pages in here. You go to page number 24. You got a demyelination association disease. Now, the myelin makes up anywhere from 35 to 80% of the brain white matter and the spinal cord white matter, depending on where it's at. It has a great, what should I say, responsibility for many, many reasons. Now, and people have been following the doctor's direction, stay away from cholesterol, you're going to get these problems because cholesterol is the raw material for your brain to make the myelin. And so Bruce Willis said, I want 10,000 people to contact Bruce Willis and suggest that he contact us because I believe we can deal with he's got what's called frontal temporal dementia, which is kind of a newer version of Alzheimer's disease because it just covers the front part of the brain and the temporal part of the brain, okay, instead of the whole brain, where Alzheimer's disease covers the whole brain. I believe we can get Bruce Willis back to normal in 3 months. So we tried, but his team, I wasn't impressed.
So Dr. Wallach, and I just want to do a call to action. If there is anybody out there that does have contact with Bruce Willis or any of these other celebrities that are having issues with or challenges with any of the conditions that Dr. Wallach mentions on the show, you can reach him by going to doc@drjwallach.com. So that is his email address, doc@drjwallach.com. And that is going to be the fastest way to be able to reach Dr. Wallach via email. So folks, we encourage you to reach out and help people. All right.
Okay,
Go
now
ahead.
the slip chart, if you're going to share information with people, the slip chart is a credibility tool. So who am I? I'm not a doctor. I'm not a pathologist. They're not going to believe me. Well, so we came up with a flip chart as a credibility tool, and we have the stories of many, many famous people we have cured their diseases. Pat Boone, Danny Glover, Theo Ratliff, Evander Holyfield, Pastor Mike Freeman, Andy Young, Pastor Creflo Dollar, Jerry Lewis, Martin Luther King III, Mike Glenn, and one of my favorites is Pastor Mike Freeman. Okay, Pastor Mike Freeman from Maryland. He was in a coma at a hospital in Maryland, and they had an IV in him and a G tube for 2.5 months, and he was just slowly getting worse and worse and worse. And they pulled the plug on him, pulled all those tubes out of him, and the IVs out of him, and called his family and said, "Look, he's probably got hours or maybe a day or so to live. So if you want to say your goodbye, he can't hear you; he's unconscious, but you'll feel better that you've at least seen him one more time and said your love and your blessings." And so one of our great distributors up there, Linda Tyler, she calls me and says, "Is there anything we can do here?" And I asked her, "Does he have a G tube?" No, they took it out. What about an IV? They took it out. So, okay, just take our liquid plant minerals, take a half a teacup and rub it on his chest and a half a teacup on his upper belly and his lower belly 3 times a day. And then do the same thing on his back 3 times a day, a half a cup of the liquid plant minerals between his shoulder blades and his upper back and lower back 3 times a day. I was expecting that to go on for a couple of weeks. She calls me the next day and says, "Pastor Mike woke up this morning and he shaved." And it took him another, I don't know, month and a half in rehab to get all his muscles working because they've been, just doing nothing for 2.5 months. And so, um, and that was 10 years ago. He's out going around the world telling his story, how God's stuff saved him. It wasn't a pharmaceutical. It was plant minerals, okay, from the earth, from the volcanoes that saved him. Okay. And isn't that cool? And so,
That is awesome, Dr. Wallach. It's amazing what minerals and the role that they play within our bodies can do, and what happens when you don't.
yeah, well, here's a list of some of the diseases that we have helped, where people have diagnosed demyelinating diseases of the brain and spinal cord where the white matter has gone away. Alzheimer's disease, Parkinson's disease, multiple sclerosis, amyotrophic lateral sclerosis, which is ALS, Huntington's chorea, frontotemporal dementia, like Bruce Willis, Bell's palsy, cervical spondylosis, optic neuritis. There's 3 more columns like that. Okay. And they're all demyelinization, loss of the white matter, the brain and spinal cord diseases. Okay. And this is all reversible. Okay. Now, the medical system treats the symptoms, and people are very grateful that the symptoms have been reduced or gone away, but then they still die 25 to 50 years early. Whereas if they were actually replacing and renewing their myelin, which we have the capacity to do, suddenly now we're adding 25 years to their life.
That is awesome, Dr. Wallach. The fact that when you give your body what it needs, the body itself, because it's continually regenerating cells, and it doesn't take any, precedence over one cell or the other. It's all the cells. The body can do some amazing stuff. It's
Yeah,
just the way we were designed.
all these wonderful pictures in here of these famous people we've helped with their health issues. Again, this is built as a credibility tool, and you still have to use the nutrients that are necessary. And this is why we have all these books and everything, and the information and the CDs and DVDs. And people say, well, who are you? How can you say that? And that's when you show them the flip chart and say, well, here's the disease in Danny Glover. Here's a disease, okay, in Evander Holyfield. Here's a disease in Theo Ratliff, and so on. Mike Glenn. These are all famous people that had diseases that had ended their careers. And in just a few weeks or months, we got their everything back for them, and they got back in their career and did better than ever.
Well, and Dr. Wallach, when people say, well, who is he? Well, he actually received the commemorative medal from Dr. Gerhard Schwarzer. And what was this for, Dr. Wallach? It was for your study with what? Or in what? Or about what?
Oh, that was cystic fibrosis.
Was this for cystic fibrosis? Which one? And so I know that you did a lot of research and actually worked with Jonathan Emord in suing the FDA to make sure that there were 2 specific nutrients that were getting into baby formula, because you found that there was evidence that when those nutrients were missing, you were getting things like the cystic fibrosis, you were getting things like cerebral palsy, you were getting things like sudden infant crib death, which then turns out to be the same thing that these athletes are dropping from while they're playing sports, which is supposed to be so healthy for them. So, Dr. Wallach, things like folic acid and selenium, which we're not going to do fractionated nutrition here, folks. These are just some of the essentials, and there are 90 essentials. And when I say fractionated, it's like, oh, I'm going to run out and just take that. Run out and just take that. It doesn't work. Trust me, I tried it. Because I heard this was good for this. This was good for this. And I wasn't getting any results. But when I tried Dr. Wallach's method and his approach to nutrition with the full 90 essential nutrients, plus the secret sauces, because I was paying into that $1 trillion amount for osteoporosis and arthritis, my body was able to just bounce back, and I no longer needed to pay into their fund of supporting a medical system that had been failing me for so many years. So,
I was gonna say, thank you so much for sharing your story. It's a beautiful story.
well, and I just, I really want to make sure that people realize that, you know, nutrition is so important, but it's not just the nutrition going in, because you can't out supplement a bad diet.
Correct.
Tell us a little bit about that part of it, Doc.
Yeah, there's a great story. A little bit about methyl.
What?
A little bit about methyl.
Beth?
Methyl, where they have their debels.
You're
Ding
talking
dong,
over.
ding dong, ding dong.
Oh. So, okay, so there is ding dongs out there that are going to tell you that you can eat whatever you want and you can just eat the 4 food groups and you're fine. Well, I was eating from the 4 food groups and I wasn't doing the junk and I wasn't doing the carbonated drinks and it just wasn't working, Doc. So why eating from the 4 food groups is not enough?
Well, there's an absorption problem. When you're eating bad stuff, it causes those villi to get scar tissue on them and they shrink and go away. And so your intestines are more like a smooth tube as opposed to a shag rug. Okay. And even if you're eating properly and supplementing and so forth, you cannot absorb the nutrients and they're all going out the other end. People say, well, I tried it for a couple of months and nothing happened. Well, what do you eat for breakfast? Oh, for breakfast, I have fried bacon and okay, and oatmeal and that kind of stuff. And that's
Right.
why.
Toast, Dr. Wallach.
I'm
I
sorry.
was doing whole grain, even grinding my own grains
Mm,
and making breads.
no.
I
Yeah,
found out that right.
yeah. You cannot eat wheat, barley, rye, oats, or buckwheat because they interfere with your absorption of nutrients.
Yes, they do. Well, folks, if you are interested in getting more knowledge and wisdom in regards to Dr. Wallach's findings from his decades of research, we do have a certified holistic health coach course that is offered by the Institute of Holistic Health. You can go to coachwithdoc, D-O-C, coachwithdoc.com and get more information about our certified holistic health coach course, where we are running a special right now. It is 50% off and you have payment options. So there's 3 payment options. You can pay in full, you can pay in 4 monthly payments, or you can even pay in 6 monthly payments, folks. We want to make sure that we are providing this program to the public in a more affordable way, and we just meet people where they're at. And I myself, as the director of student services for the Institute of Holistic Health, just really encourage you to reach out and get this information, because folks, information is power. It's knowledge is power that we cannot have taken away from us. And when we arm ourselves with information that actually works, we can help a lot of people. And we encourage you to join arms with us and get together with the person that shared this program with you. Say, hey, I want to know more about this program. I want to be part of Dr. Wallach's army in his crusade to save humanity and the world. And folks, as you do your part, you work with the community, and each of our communities work together, we can make an impact in the world. So go to coachwithdoc.com and sign up today for that certified holistic health coach course. Now, Dr. Wallach, we have some questions that are coming in, and the first one that I want to go over, I had it up here. Where did it go? Of course, it wants to do an update now. No, we don't have time for that. Okay, so here we have a 63-year-old female that was diagnosed with compensated liver cirrhosis. Current MELD score is 8, but she has symptoms of a bloody ulcer in her mouth, bruising on her arms and legs that are slow to heal, potential diabetic neuropathy, ulcer on her big toe that is very painful. And she is wanting information, Dr. Wallach, on what she can do. It's actually her husband that's reaching out on what they can do to help her. So she is 63 years old. I'm not quite sure what the weight is. So let's go for 500 pounds. What would you recommend for somebody who has cirrhosis of the liver and ulcers in their mouth, slow to healing as far as the bruising goes on the arms and legs, and potential diabetic neuropathy? So if there's potential diabetic, there is possibility that she has some blood sugar issues.
Okay, so got to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no barley, rye, oats, no buckwheat. Then needs to stay away from, let's see here, I'd go ahead and stay away from the grains, stay away from, I guess that covers it. Stay away from all the bad stuff, okay? Then per 100 pounds of body weight, let's go by 100 pounds of body weight, she needs 1 healthy brain and heart pack per month. If she only weighs 110 pounds or 90 pounds, she can take a half a dose of that, of everything there. I think there's 215 items. 215 items in
Nutrients.
nutrients in the healthy brain and heart pack. And so she can go ahead and take a half a dose of everything at breakfast, half a dose of everything at dinner time. If she weighs 135 to 150 pounds or more, I already have 2 healthy brain and heart packs a month, a full dose of everything twice a day. Then I want her to have the, let's see here, let's see, she needs the digestive enzymes. She needs our digestive enzymes, okay? And she needs to go ahead, and I'd go ahead and take 2 or 3 of those, say 5 or 10 minutes before each meal, not during the meal, but 5 or 10 minutes before the meal. So the tablets are beginning to fall apart before the food gets there, right? Then we want her also to have, again, per 100 pounds of body weight, 1 healthy brain and heart pack per month. And then if she only weighs 100 pounds, then she can take half a dose of everything at breakfast and half a dose of everything at dinner time. If she weighs 135 to 150 pounds or more, then she needs to take a full dose at breakfast and full dose at dinner time. Then we want her to also take the, let's see here, the digestive enzymes. We want her to take the ultimate enzymes. She can go ahead and take 2 or 3 of those, say 5 minutes before each meal, cut with some water, and that will help break things down so it'll be more easily absorbed. And we also want her to stay away from the bad foods. No fried foods. We already said all that. Okay, very important. And let's see here. I think.
Anything extra that you would add for the liver, Dr. Wallach?
Well, if she could have more selenium, we could get some more selenium and have her take 2 or 3 of our selenium at breakfast, 2 or 3 of our selenium at lunch, and 2 or 3 of our selenium at dinner time. Okay, that's going to support the liver health and function. We do have that sort of thing. We have the digestive aids. Okay, she could take our digest-ease. Okay.
And did you? Yep. So the enzymes. And did you mention the I-26?
I did not mention I-26, but that would be a good one. I-26. I-26, of course, helps with dealing with um, optimizing digestion and absorption.
Mhm. Absolutely. Absolutely, Dr. Wallach.
Go ahead
Thank
and
you so much.
take 2 or 3 of those twice a day per 100 pounds of body weight.
Yep, absolutely. So depending on with the I-26, depending on whether you go with the powder or you go with the chewables or the capsules, 1 scoop of the powder is going to be a dose, and 3 of the chewables will be a dose, which if you're doing 3 per day, that's going to be 2 bottles. Or we have the Longevity has the capsules, which a dose would be 9 that you would be taking. So
Mhm.
you don't want to take those if you are eating eggs. Let me rephrase that. So you don't want to have them within 2 hours of eating actual eggs because they are a hyperimmune egg product. We want to make sure that there's no interference with store-bought eggs or even homegrown eggs and the antibiotics and enzymes between the two. So thank you so much for that recommendation, Dr. Wallach. I know Scott's going to be very appreciative of that as he will be getting the replay for today's program. He's listening to us live in the live stream. And folks, you can go to our YouTube channel, and that is the Critical Health News YouTube channel, or on Rumble or on Spotify. Just search for Daily with Doc, and you will find all of the different locations that our program is being broadcasted on, and you can catch our replays. Now, Dr. Wallach, we have a question here wanting to know, is there a video or audio of the Mike Freeman testimony? And yes, folks, if you go to drjwallach.com, you want to look up Praise the Lord and Pass the 90. And that tells about the story of Dr. Freeman and has an interview with Dr. Freeman and Dr. Wallach there for you to utilize as a tool for knowledge as well. So, Dr. Wallach, I've got another question wanting to know what is the importance in development of the embryos or children or in people in general of folic acid?
Okay, well, folic acid has to do with digestion, liver health, brain health, so forth. And so, and immunity, bone marrow. So there's a lot of stuff going on that folic acid is required for. And it's one of those, it's, considered an essential nutrient for that reason. Okay. And so this, in the world, this comes from green leafy things, uh, fruit and those, kind of things. You don't get folic acid in meat. You might get a little folic acid in liver, but not, in red meat kind of stuff.
And with the folic acid, Dr. Wallach, you were very instrumental in getting that added to prenatal vitamins.
That's correct. And if it prevents, birth defects in the face, the brain, and heart, and so forth. And so it's a very, very special nutrient for the embryo.
Well, and then let's talk about a little bit about selenium, because I know you were very instrumental in getting that added to baby formulas. So what is the significance of selenium as part of the 90 essential nutrients?
Well, selenium is required for heart health, heart muscle health. Okay. You don't want to be having a heart attack. Um, this would go on when you had babies dying of crib death. Okay. There's 2 weeks old, 2 months old, 6 months old, and they die in the crib. They could be dying
Mm-hmm.
of selenium deficiency because the heart stops, the liver stops, everything stops when you don't have enough selenium. And so it was very obvious to me as a pathologist. I'm seeing all this stuff coming across my pathology table, and I had to do a lot of research to figure out why it was happening because, they were well-to-do families and they were doing all the right stuff. But there were little pieces that were interfering with getting those nutrients to the babies. And you don't hear anything about cystic fibrosis anymore. You don't hear anything about muscular dystrophy anymore. You don't hear anything about the um, uh, sudden death syndrome because we sued the FDA in federal court 8 times and won to get those nutrients put into the baby formulas and into milk And so we eliminated those diseases by putting those nutrients into foods to guaranteeing that they'd be there. So we're very proud of that action. Those 3 diseases are gone because of that.
Yes, and I know that I'm so thankful that you did not give up because you had a lot of resistance.
Yeah, they fired me from Yerkes Primate Center when I told them that this was something we could eliminate by putting these nutrients into the formula, and they fired me. And so it was a big hoo-ha back in the day.
You know, all adversity works together for good, and I'm so glad that they fired you, Dr. Wallach. Let's do one more question because we are coming up to the top of the hour, and I know in the future you're going to be on the radio again, and this will be the time that you'll have to be getting off anyways. So real quick, we have a gentleman that's on with us today. His wife is 73 years old. She weighs 115 pounds. She is on a medication for thyroid. She has had a brain scan showing shrinkage of the brain and is diagnosed with dementia. What would you recommend she start on for these conditions, Dr. Wallach? And thank you, Douglas, so much for submitting your question.
She weighed 115 pounds.
That's correct.
Okay.
115, 73 years old.
Okay, so get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, rye, and oats, no buckwheat, no sugar, no carbonated drinks. And then I'd go ahead, since she has all these problems, and give her 2 healthy brain and heart packs a month to start with, a full dose of breakfast, full dose of dinner. I want her to have yeah, let's see here. We want her to have the program we have for thyroid. Okay. She's got to have what is it? Thyroid?
For the thyroid, the Ocean's Gold,
Ocean's Gold, yeah.
Fucoid,
Yeah.
or there's
And
the
so
Good Herb.
go ahead and take a couple of capsules of the Ocean's Gold twice a day and a Fucoid twice a day. And then I also like to have, let's see, did she have anything else?
That's all that's mentioned. Oh, the shrinkage of the brain
Oh,
from that.
okay, she needs myelin. She needs the I-26. She's the I-26. I'd have her take 2 or 3 of those 3 times a day. The I-26, it'll rebuild the myelin in the brain, and the brain will come back to its normal size. And there's a whole big research project we're working on this, and we've proven that. And again, we talked about demyelinization. The white matter of the brain is also scientifically called myelin. Okay, that white matter in the spinal cord is called myelin. And when it shrinks and goes away, that means the patient is not getting the nutrients necessary to maintain that tissue and winding up getting all these terrible diseases. And so it's imperative. And I'd go with, if they weigh 146 pounds, is that right?
115.
115, okay. 115, I'd go ahead with 2 bottles a month of the, was it the ultimate selenium?
Oh, there is ultimate selenium. Are you talking about for the dementia or for the thyroid?
The thyroid.
So the Ocean's Gold.
Ocean's Gold, yeah, there you go, Ocean's Gold. Go ahead and take 3 of those twice a day, okay? And it may seem heavy-handed, but you got a pathology here. And then once everything gets to be normal, you can cut it by 1/3, okay?
All right. Thank you so much for that, Dr. Wallach. And Dr. Wallach, it's a brand new year. You were on vacation for a little bit. And as I'm looking through the comments on YouTube, it is just it's flooding in. I missed so much trying to keep up with everything. But it says, Happy New Year. Love you, Dr. Wallach. Love you, Dr. Wallach. You are a bright light in this world. There's another person that said I used to take generic stuff and all the stuff that Dr. Wallach recommends. He couldn't afford, but was glad that he started on it and now is feeling great. Have another person here that says my entire skull and spine are off the charts. The FlexiCare, OsteoFX, Glucogel, MSM, collagen peptides are so strong. I can feel my entire body being reborn. And with that, folks, this program is for informational purposes only. It is not meant to take the place of your primary care physician, nor are the products meant to treat, diagnose, or cure any diseases. But folks, when you give your body what it needs, the body itself can do some amazing, amazing things. So thank you so much, Hunter, for sharing that testimonial. That is absolutely fabulous. We have Sylvia joining us from London saying, hello, Dr. Wallach. We have Global Kids saying, have a blessed day. It's so good to see you all. Happy New Year's. Happy New Year's. Lots of Happy New Year's to you, Dr. Wallach.
Happy New
And
Year's back to them.
yes, well, Dr. Wallach, we do love you. You are absolutely a shining light in this world. And we have some
We'll
of the
give all
same.
the credit to the big guy in the sky.
Oh, absolutely. His light is shining through us. And Dr. Wallach, I am just so thankful that he has given us this information to share with others and to be here with you side by side again on Zoom. I am just so excited for the things to come.
The future is
So
going to be great.
this year is going to be even more fantastic than last year. That is for sure. Thanks everybody for joining us here on Daily with Doc. Dr. Wallach, I'm just going to have our crew that's on with us today come on screen because folks, we could not do this without them. And Dr. Wallach invites you to join the crusade, join the army. These are some of the people that have stepped up and are doing that. We just want to give a special shout out to Marilyn as she is putting information in the chat. So folks, that's one of the biggest benefits, that and being able to raise your hand and ask questions of Dr. Wallach right here on Zoom, is that chat where Marilyn is repeating what Dr. Wallach says, typing it up and putting it in the chat. We have Albert, who is keeping an eye on everything and letting people into the room, making sure that it stays a safe place for all. We have AJ with us today, who is making sure all the streams are going out, drawing my attention to things that are going on in the comments of the different places that we are streaming. So I couldn't do this by myself. And we couldn't do this without Dr. Wallach, because he's the one that started this crusade. He's the one that did the research. He's the one that wrote 24 books now that have been published and are being distributed around the world. And Dr. Wallach, I just want to thank you, because if it wasn't for you, I would not be here today. And I would not have the health or the purpose or the passion for life to share with others.
Well, thank you so much. You're a gem. You're an angel of God, and you're not here by accident. The good Lord, I'm sure, appropriated you purposely.
Well, I think we all have a purpose, Dr. Wallach, whether we've found it yet or not. Folks, keep going. And if you are looking to be part of a community that is serving a great purpose, we invite you to join us. If there's no one to thank, go to DailywithDoc.com, use that contact option and send us an email. We also have a newsletter email, or an email list, that is available that you can sign up for and even submit questions there. So folks, we'll get you connected with a certified holistic health coach. The website and our call number are for those that are not working with somebody already. So if you are working with somebody, make sure that you get back with them. If you are working with somebody, make sure you get back with them. If you are not, feel free to give our team a call at 855-949-3377. Again, that's 855-949-3377. Again, thank you, team. I think we had another great show, and we will see you. We're live on Friday with Pharmacist Fridays, and then we will have Dr. Wallach back with us again 2 days next week, and special guest, and then pharmacist Ben again on Friday. So folks, stay tuned. Make sure you're following us. Make sure that you are subscribed so that you get that notification when we go live. And even on the days that we don't go live, folks, we are live streaming one of our replays for your enjoyment and knowledge enhancement. Until next time, I will always be Becca Dukes. Thank you so much for joining us here on Daily with Doc. Bye for now.